Have you had a C-section? C-sections can cause a lot of trauma in our body for the many years to come. This video is going to go over exactly what you need to know in order to truly heal from your C-section. This will be true even if you had the C-section 5 and 20 years ago. You're going to know signs to look out for, that your C-section scar maybe didn't get fully healed, and things that you can do now to start the healing process. I'm Dr. Allison, owner of Body Motion Physical Therapy in Edmonds, Washington, and I am here to help women get the care that they deserve and help them through the fertility, pregnancy, and postpartum journey all the way through menopause. So many times I have people come in with lingering sciatica or low back pain that just doesn't go away with normal physical therapy, and they've done all the exercises, they did everything that they were instructed to do to help heal the pain, but that provider never got to the root cause of what was causing that pain in the first place. And oftentimes, so many times, it's because we don't heal our C-section scars completely. And so I am really glad that you're here today, because I'm going to talk all about how the core and the pelvic floor are connected, and how when you have a cesarean or a belly birth or a C-section, how that is going to impact your healing process and what needs to happen for you to truly heal from that cesarean. Okay, so first things first, when you have a C-section, the abdominal wall is cut. They cut through 7 layers of tissue, all the way from the skin, the muscles, the fascia, down to the uterus. The fascia is like saran wrap that covers everything. And so if you imagine that you're wearing a one-piece swimsuit and you have a cut in that swimsuit, when that tissue heals, the scar tissue builds and bounds down. And that's what healing is for the scar tissue. That's the scar tissue that's created. You have temporary stability in that tissue so you can get back to your normal exercises and start doing things. The issue becomes that because so many layers of scar tissue exist, we have things like the muscles don't work normally anymore. Because if a muscle was the belly muscle, if it contracts and relaxes, when it has a C-section scar in it, that scar limits the amount of contraction that can occur and the amount of relaxation that can occur. And so that muscle becomes really weak. So the front ab muscles, especially the transverse abdominis muscle, is gonna get a lot weaker. And so in order to truly heal that, we need to break up that scar tissue and then retrain that muscle. So who can do that for you? Well, a skilled pelvic expert physical therapist can absolutely help break up that tissue and then teach you how to use it again. If you've done online fitness programs, or you feel like you've never been able to get back into your fitness routine after you've had a C-section because you always get hurt, a lot of times this is the missing link here, that your C-section scar hasn't truly been healed. And when we have tissue that bounds down over the years to come, so say this is my C-section line and it starts to bound down, it's not only going to pull down from exactly where the C-section is, but it's going to pull from the arm, it's going to pull from the pelvic floor, it's going to pull from the legs and the back. And so it's really important that we get this tissue moving. So how do we do this? We work the tissue. We use our hands in pelvic floor physical therapy. I am a pelvic expert physical therapist. We use our hands to start to break up this tissue. A lot of programs that you're going to find online or videos are going to show you what scar mobilization looks like, and maybe they'll have you cross friction the scar. If this was the scar line here, they'll have you cross friction the scar. They'll have you pick up the scar and move it around. But because we're talking about the scar and all these different layers of scar tissue, we need to get the entire scar moving. And so it's not just this first layer, it's the second layer, the third layer, all the way down to the 7th layer. We need all of that scar tissue moving. And so we do that through our hands. We also have a really cool technology called shockwave therapy, and we use this in the clinic. We just brought it in-house in order to help break up those and dissolve the final bits of the scar that we can't quite get with our fingers. This has helped tremendously with the muffin top or the shelving that you'll get over your C-section scar. Obviously, that's more cosmetic in nature, and to truly have this healthy, happy core, we need the core to be able to contract and relax and just do that automatically without thinking of it. But you can never really adequately change the core and start building the core without addressing the scar tissue. So I see so many people heal after having their baby, and they do some exercises to get their core back get their belly back, and they don't actually heal or strengthen all of the tissue, and it's not normalized because there's still those deep layers of scar tissue. Another facet of this is that the organs itself, because the uterus was cut open, the uterus has to move within the body. That is called visceral motility. And it is, so the uterus just moves, the fallopian tubes move, your colon, it moves in your body. So when you contract your core, the organs get squeezed in. When you relax it, they go out. And then they move in the body without you breathing, without you contracting your core. They just naturally should move. But when we have scar tissue, and this is from any abdominal surgery, it doesn't just have to be a C-section scar, but when we have any abdominal scar tissue, that will freeze the organs so that what covers the uterus itself is called endopelvic fascia. And then what covers the colon is called peritoneum. And when those structures freeze because the scar tissue has become so dense that the organs now can't move fully, then we have more problems. And the body can't flex and bend over that scar tissue as easily. And we start to develop compensation patterns. So the body develops compensation patterns because those muscles aren't moving fully, the fascia is not moving fully, and the organs can't ebb and flow, AKA move fully. So we have to restore the scar tissue, we have to restore the visceral motility, and we have to then retrain the abdominal muscles. Okay, so that is the process of healing the scar tissue. This is super important because oftentimes we see women in their 40s and 50s, they have hip pain, they have knee pain, they have sciatica, and they've had a C-section, and they have these aches and pains now, or these issues, because they never healed their core postpartum. This isn't common practice. People, especially 10 years ago, postpartum physical therapy rehab was not that common. And so now we have this resource, and we've always actually had it since like the 1930s, I believe. But at least in the US, it started first in England, but then came to the United States. And so we've had pelvic floor physical therapy for a long time. It just isn't common practice for women to actually get this care. And I will tell you, even if you've had a C-section 20 years ago, it is not too late to start healing the tissue and unpeeling the layers of compensation that your body has developed. These layers of compensation are what cause the hip to wear out. They're what cause the opposite knee to start getting pain. Usually when you have those areas, you'll maybe go to physical therapy and they'll treat the knee or they'll treat the hip, and they're not looking at the entirety of the core, the entirety of the abdominal wall, or of the pelvic floor. So it's really important that you see a pelvic expert, even if you're 50 and you had a C-section 20 years ago or 15 years ago, because if we start replacing the joints and then we start giving these joints injections, we just start chasing these pain patterns, okay? So we're not actually healing the true root cause, which is this scar tissue in the abdominal wall, and the fact that we never got the belly and the core retrained, okay? So anytime there's that scar tissue, it's gonna limit the natural function of the muscle, and that's just on the belly front. So now if we dive deeper to the pelvic floor, so the belly is on the front, the abdominal muscles that are cut are on the front, the skin that's cut is on the front, but the pelvic floor is very much affected. So here I have my pelvic floor model, okay? So you can see all the structures of the pelvic floor. The pelvic floor is 3 layers deep. The second layer, which is not shown here, is more of a fascial layer, and that layer connects up towards the fascia in the abdominal wall. So when the fascia in the abdominal wall is cut open, then stitched back together, it's gonna pull up and elevate the pelvic floor. So it's really common after cesarean births to have painful intercourse, painful penetration. Urinary incontinence is very common post-cesarean births. And a lot of times people are like, how is that even possible? My pelvic floor wasn't affected. Or they opted to have a cesarean birth because they wanted to preserve their vagina and their pelvic floor. But the pelvic floor and the pelvic organs are very much affected when we have the cesarean belly birth. I want to tell you how to start to heal these pelvic organs and the pelvic floor itself, okay? So a healthy pelvic floor is gonna be able to relax fully and contract fully and also overstretch fully. So every time that our foot hits the ground, we have this shock absorption, which is like a spring mechanism that we get this recoil when our foot hits the ground. Well, if your pelvic floor becomes very tightened and fibrotic and shortened due to having a C-section, or maybe you've just always had a tight, contracted pelvic floor that is shortened in nature, and that's just how you've lived. Maybe you've had a stressful life. The pelvic floor gets shorter when we have stress in our life. It doesn't always just naturally relax. And so it's really important that we train the muscles to relax and that you have what's called an intravaginal assessment during your pelvic floor physical therapy recovery or rehabbing of the core itself. So even though the baby came out of your belly, whether that was 6 months ago, 18 months ago, 20 years ago, it doesn't matter. You should definitely have your pelvic floor looked at to make sure that your muscles have that ability to fully relax, overextend, and contract, so that when your foot hits the ground, you get that natural force absorption. Now, if we don't have that, what happens is the pelvic floor turns to more concrete and you just don't have a lot of dynamic movement and you don't get the spring effect. And so you start to wear out your joints. So your hip starts to hurt, your knees starts to hurt. Okay, so all of these facets play together after we have a cesarean. When I see women after they've had cesareans, usually about 10 years later, there's possibly some form of sciatica going on. Not usually, but very frequently, they have uterine ablations or a history of uterine ablations, and that's where they go and limit the menstrual cycle essentially. So they ablate the inside of the uterus to help prevent bleeding, usually because a lot of times when you have that scar tissue through the uterus and it's 10 years old, that scar tissue actually hardens and gets more hard, and so those women tend to have very, very heavy periods, and I really do believe it's because that scar tissue that's deep in the uterus over contracts probably to compensate for that scar, and so you get really heavy bleeding, in order to combat that, the medical procedure is to ablate the inside of the uterus. And we can help avoid that by really healing and getting to the root of the scar tissue and breaking up the scar tissue and helping the organs move more freely so that the menstrual cycle can be a lot better and easier to have, and the bleeding is less, and also cramping can be a lot less. We also see that women about 15 years post-cesarean can be more susceptible to bowel blockage because the scar tissue can go and cut off some of the bowel, leading to bowel resections. And so if we can help heal that scar tissue any time before that happens, then we can really help improve the outcomes of women's health. And I just fully believe that every single person who's had a cesarean needs to get their belly looked at and needs to get their pelvic floor looked at and treated and spent time on the scar tissue and spend time on these muscles, helping them release the scar tissue, dissolve the adhesions that come because of the scar tissue, help improve the tightness that comes because of the scar tissue, and then retrain the muscles in order with exercises and with different things that you can do at home, with different breathing exercises, different core exercises that can truly help retrain the tissue and cause full healing so that you're not the person that has all these issues post C-section when they're in their 20s or when they're 20 years later post cesarean. So I hope this was helpful. Find yourself a pelvic expert physical therapist or come see us for our travel program, and we will help you dissolve this scar tissue and retrain your core. So take care.